I wanted to thank all of you for being here today. I wanted to ask you to take the time out of your busy schedules if the information I was going to share today wasn't life-changing or could even save your life or somebody's life you know. The reason that I got into chiropractic wasn't because of back pain or neck pain. It was actually because I had severe migraines and sleeping problems when I was younger, about 12 years old. For years, I just did the traditional thing, taking medications, trying to stay in a dark room, and didn't really get better. Eventually, a family friend suggested trying a chiropractor. My family didn't know if it could help or why it would help, but I went, and after the first adjustment, no more migraines. I was sleeping better than ever. So I feel like I have an obligation to share this message with as many people as I can and show you how it can really change your life. It's the most important question we're ever going to ask ourselves, because health is the most important thing in our lives. If we lose our health, what do we lose? We lose our lives. We lose everything. You can't enjoy your family, your friends, your hobbies how you're supposed to. So we need to know, where does healing come from? Well, does healing come from medications? Okay. If that were true, then the people on the most medications would be the healthiest. But obviously, that's not true. The people on the most medications are the sickest, and the people on the least are the healthiest. So something from outside the body can't heal our insides. What about a chiropractic adjustment? Is that where healing comes from? Well, this is a trick question because I'm the chiropractor, and you expect me to say that's where healing comes from. But you're right, Preston. It doesn't come from a chiropractic adjustment or medication, because nothing from outside the body can cause healing inside the body. The only thing that can cause that is life itself inside of us. There's a power within our bodies. In chiropractic, we call this an innate intelligence. That's what works on keeping our body surviving, adapting, and thriving every second, every day of our lives. Every thought or action you've ever had is influenced by this innate intelligence. The life inside of you is what heals you, not doctors. You are the doctor. Okay? There's a doctor inside of you that's healing you right now. In order to see where that intelligence comes from, we need to see where life begins. So life begins with two tiny cells, a sperm and an egg. They come together and they multiply, until there's 50 to 70 trillion cells in your body. Isn't that pretty amazing? And that whole body is formed perfectly with all your organs, all the blood cells, all the arteries and veins, without any help from outside. There's no blueprints, no doctors, no medications, no surgeons telling the body how to form perfectly. It just does it all on its own. Isn't that pretty amazing? And it's all because of that intelligence inside of us. Where the sperm meets the egg is the first organ in the body. The first organ in your body is the brain, and the first part of the brain that's formed is the brainstem. The brainstem's formed first because it controls all your vital functions in your body. So for your heart to beat, for your lungs to breathe, even for your immune system to fight bacteria, viruses, even cancer cells, the brain has to be working perfectly and sending out those messages. After the brain forms, the rest of the nervous system forms, and before any organ in your body is formed, the whole nervous system is finished forming. That's because every organ is connected to a nerve. Every cell gets messages from the nervous system. If I cut the nerve that goes to the heart, what would happen? It'd stop beating and it would die, right? Exactly. So this is a very important system in our body. Did that wisdom that created us, those thousands of years inside of our bodies that created us from two tiny cells into a perfect human being, did it leave us once we're born? No, of course not. We were born perfectly. We're self-healing organisms, and we're supposed to be healthy until 100 years old. That's what science now shows, is that we're supposed to live without anything from outside helping us until 100 years old. One person out of 1,000 lives to 60 years old in good health. Okay? So even if you think this isn't affecting you, it is. Okay. Unfortunately, most people nowadays say, oh, I'm 40 or 50 years old. I must be just getting old. I have all these aches and pains, or I'm getting these conditions. It's just aging. But we're supposed to live to 100 in good health. Okay, so we're doing something wrong. Those 50 to 70 trillion cells in our body, there's cells dying every second of every day. But it's okay because there's new cells to replace those old ones. Every 90 days, heart cells die. Every 120 days, red blood cells die. And every 14 months, your vital organs are completely replaced. Every 7 years, you have a brand new body. Isn't that pretty amazing? The only irreplaceable organ in your body. Everything in your body can be replaced except your brain. There is no such thing as a brain transplant. It's the first system to develop in your body. Creates all the new cells, the master control system for all the other organs. And now we find out it has to last you your entire life. How many of you brush your teeth every day? Go to the dentist for a checkup, hopefully yearly. Change the oil on our cars, get maintenance on our cars. Everybody. Most people in the public have never had their nervous system and their brain checked before. And that's all because of poor education. It's the most important part of our body, so wouldn't it make sense that we get it checked? Exactly. Taking care of your brain and your nervous system is all that chiropractic wants you to do. While medicine focuses on trying to cure sick cells, but we know that our whole body is connected, so you can't just treat one area while not looking at the rest of the body. Chiropractic focuses on making sure those new cells are being created healthy because the old ones are going to die in a couple months anyway. If the new cells are being created healthy, then you have the greatest potential to heal from anything. There have been people with every disease on the planet that they were told that they had a terminal disease, they weren't going to get better, and they decided not to go the traditional route and try something else, and they got better. What was happening there? Because there's new cells being created healthy, replacing the old sick ones, and they got better. If the new cells are being created just as sick as the old ones, you're going to have the same problems and the same symptoms you've always had. Next, we're going to talk about the brain-body connection. As a chiropractor, what I focus on is called a subluxation. When you have perfect health, your brain sends messages down through the brainstem, through the spinal cord, out over the nerves to every single cell, muscle, and organ in your body. When that first bone misaligns, called the atlas, it blocks or alters those messages coming from the brain down to the brainstem, right here. Wherever those messages are going, it's going to affect your health, and it's going to start to break down your body. So when we adjust this area and put it back into the right place, the messages get out clearly, and your body can literally heal from anything. Literally crushes life from your body. There's no difference between this light bulb and this light bulb. The only difference is that this one has a dimmed energy source. It's the same thing that happens in your body when you have a subluxation. Let's take Christopher Reeves, for example. He fell off a horse. He broke the top bone in his neck, the atlas. It put over 1 centimeter of pressure on his brainstem. And what happened? He was paralyzed. Exactly. Everybody knows about that. But what was more than that was his organs started to shut down. He needed a pacemaker for his heart. He needed iron lungs to breathe for him. He needed all these things to keep his organs going because they weren't getting the right message from the brain to the organs. If the nerves healed, if the brain got out the right messages to the organs, they would have healed. Just like this light bulb, there was nothing wrong with his organs. It was just that they weren't getting the right message. Obviously, a subluxation can affect your health. Most of us view our health like an iceberg. You can only see the top 15% of the iceberg. The other 85%, the bigger part, is hidden underneath the water. Most of us say, well, if I feel good, then I must be healthy, right? That's how most of us take care of our health. But let me show you the danger of doing that. Okay, all this time, for months or even years, the cause of the problem is growing underneath the surface, and then one day you wake up and you have a symptom or a disease, and you think that you just got sick overnight. But really, it took months or even years for that symptom or that disease to show up. And one of the things that I feel like I have a responsibility to do is teach people to not wait until they get a symptom or a disease to take care of their health. And that's one of the reasons I do this presentation. Next is mental thoughts, decision making, attitude. They're all affected if you have a subluxation. Does anybody ever feel like this? Like you have brain fog? Well, it could be because you have a subluxation. If there's a physical pressure on your brain, it's going to affect how you think, how you act, even your relationships. I've had patients come through here that were told that they needed depression medication, kids with ADD and ADHD. All this goes away because if there's a physical pressure on the brain, it's going to affect how you react to the environment. So we've seen amazing results with those kind of things. Next is performance. How many athletes at the Olympics do you think have chiropractors? Almost all of them, if not all of them. And it's not because they have back pain or neck pain. It's because they're taught that the nervous system controls everything. For the muscles to contract at the right millisecond, to breathe in the right amount of oxygen, even to create those new healthy cells from the ones they just broke down in a workout, they need a good nerve supply. Don't we deserve just as good nerve supply as athletes do? Of course, we all do. This is a timeline of how we take care of our health. 100%, you're functioning completely, you're completely healthy. 0% is death. Somewhere along the line, let's just say 59%, you get a symptom. At 60%, when you have no symptoms, are you completely healthy? Of course not. You're just 1 degree away from that iceberg, from that catastrophe in your life. At 59%, what do most of us do? We go to a doctor, we take some medicine or some kind of treatment, and we get back to 60%, and then what do? We're conditioned to think that we're 100%, we feel better, we must be healthy. But we're really just at 60%, and we're waiting for that next symptom that we get, and we go back, and we keep doing this like a cycle. Okay, until one day we get stuck at 59%, and we're told we have to take something for the rest of our lives, and we go slowly down this direction. My goal is to teach everybody how to take care of their health so they can get as close to 100% as they can. There's a couple of ways to do that, to get towards 100%. Eating well and exercising are two of the most important things you can do towards your health. What I work on is the nervous system. We all need a good nerve supply to make sure our body's healing and functioning correctly. Another important thing to talk about is who pays for our health. If we're at 59% and we want to get back to 60%, who pays for that? Most of the times insurance pays for it, right? Okay, we pay for insurance, and thank God we have it for traumas or accidents, but they only pay for us to get out of pain. They're never going to pay for us to get to 100%. They're never going to pay for our fruits and vegetables, for exercise. They might pay for some of chiropractic care to get out of pain, but they're not going to pay for everything to get you to 100%. So who needs to pay if we want to get from 59% all the way to 100%? We do. We need to take responsibility for our health, right? I do make very affordable care plans that are actually less expensive than going through insurance because I know that it's important for everybody to get this. I want the whole community changed and to be able to get under this care. We see families here, we see single people, we see younger people, so we make it really affordable so that anybody can come in and get care. The next thing we need to talk about is time. Most of us are used to taking something and then 5 minutes later we feel better. But is that really true health? The good thing is, unlike eating well or exercising, I don't need to see you every day here. At the beginning it's more frequent because most of the time your body's been in a bad position like this for months or even years. When I put it back, your body wants to go back into that old position. So at the beginning it's more frequent, but very quickly it goes down in frequency and then becomes maintenance care, just like going in for a checkup. There's many ways we get subluxations. Car accidents, sports injuries. How many people can relate to this? sitting at a computer for hours at a time, not moving. Our spines are flexible because they were meant for movement. We were never meant to be sitting in one position for hours at a time. Falls as a child, and even the birth process itself. Naturally, women are supposed to be standing or squatting when they deliver babies so that gravity assists in the process. When women are on their back, that takes gravity out of the picture, and who has to use more force? The doctor and the mother. The mother has to push harder, and then the doctor actually has to twist the head to 90 degrees and pull. Does anybody think that this looks normal or safe? No, and it's in every medical textbook. That's why I will check any child or any baby for free, because I know that it can change their lives. If we get rid of the subluxation when they're that young, it holds for months and months and even sometimes years, but it really can change their lives. They won't end up getting the same symptoms or the same problems that their parents or their grandparents have. The only doctor trained to detect and correct subluxations is a chiropractor. The type of chiropractic that I do is called Upper Cervical Care, which focuses on that brain-body connection, because as all of you know now, it's the most important part of your body. If you're not getting rid of that subluxation, then your body is not functioning at 100%. And that's why I do this type of chiropractic. The way I detect the subluxation is with a nerve scan that looks for inflammation in your neck. When the bone misaligns, it irritates the nerves and shows up as heat in your body. I take a specific set of x-rays to see exactly where the bone's lying and how long it's been there. That means that every adjustment is made specific to each patient. Every time somebody comes in, I do this scan to see if they need an adjustment, because the x-rays show me exactly where the bone is, so the adjustment's very specific to your body, and the adjustments last longer. This is before and after x-rays of somebody that's been under care. There's supposed to be a nice curve in the neck, just like a bridge that puts the body in the perfect position so that the messages can get out clearly, and that the pressure gets distributed along all the bones and all the discs. When the curve comes out like this, it stretches the spinal cord and brainstem and actually puts more pressure on these lower bones and discs so they start to degenerate quicker. You can see after care, the body went back into the normal position. The other reason that I like the upper cervical care is because everything's done in a neutral position. That means there's no twisting of the head, no popping or cracking noise. It's safe enough for newborns and elderly people. One of the top things that I hear when I tell people I'm a chiropractor is, oh, don't touch my neck, or don't twist me or crack me, okay? Because people are scared of this. Okay? They think it's like a kung fu move where they're going to become paralyzed. Okay? All chiropractic is safe, but especially with this type, it's very gentle, and it removes that fear of people that have never been to a chiropractor because of this reason. These are a couple testimonials of people that have been under care at this office that have seen some amazing changes in their life. Lenny came in. He just told me he had some minor back issues he wanted to take care of. After the first week, he came back and he told me, hey, I had this restless leg syndrome for the last year and a half, and I didn't tell you about it, and it went away. Okay, that was amazing. I mean, and it's been away since he's been under care. He also came in, he had fatigue, and he said he has more energy now. He can think clear. It's really made a difference in his life. Then Richard, he's had years of severe neck and back pain. He thought it's because he lifts his wife out of a wheelchair 65 times a day because she has MS. Okay? He was told even surgery, nerve blocks, they weren't going to work for him, so he should just give up. After the first adjustment, he called me later that day. He said, I don't know what you did, but it's amazing. He said, I don't have any more back pain. I can walk on my floor now without shoes on. It literally changed his whole life. He decided then to bring in his wife, Donna, She has MS. Some of the common signs are double vision and loss of mobility with the extremities. After a short amount of time under care, her double vision went away. And then a couple more weeks went by, and she started to be able to move her arms in different ways, in different movements than she's been able to in years. And she goes to physical therapy every day for the last 11 years, and she hasn't been able to do these things. There's amazing changes happening in these people's lives. So who should be checked for a subluxation? Everybody, exactly. Everybody, because everybody has a nervous system, everybody has a brain and a brainstem, and we all need to take care of it because it's the only part of our body that we can't replace. You never know how far-reaching something you think, say, or do will affect the lives of millions tomorrow, so please help spread this message. I'm only one person, and I can only spread it to so many people, but I feel like I have a responsibility, so I ask you too, now that you know this information, to spread it with as many people as you can, because you can really save somebody's life. Okay? The choice is yours. Do you want to live with a dim bulb, or do you want to live up to your full potential?